Welcome back. In your morning medical news, it is the one day of the year dedicated largely to eating. Of course, we're talking about Thanksgiving. Americans spend about an hour and a half eating and drinking on the big day. Even if you've loosened that belt, the danger of overindulging is real, especially since it takes about 20 minutes for your stomach to tell your brain you've eaten. So to make some better choices, the experts say half of your plate should be vegetables. Eat slowly, wait before you have seconds, and drink some water.
My philosophy is eat as early as you can, and that way you give time for your stomach to empty, for you to then feel hungry again, and you can actually have leftovers the same day. Drink alcohol later, because what alcohol can do is alcohol and fat can decrease stomach emptying.
But if you are prone to heartburn, you should avoid alcohol, the doctor says. Also, with overeating and fatty foods and caffeine, all things to avoid. Don't lay down within an hour or two of eating, and treat your heartburn symptoms with antacids and water. Offering the HPV vaccine to adults ages 27 to 45 may not prevent HPV-related cancers or cut costs. New research published in the Annals of Internal Medicine found vaccinating this large group is more expensive and less effective than vaccinating younger people. Study authors believe vaccinating those 27 and younger is the most effective way to prevent cancers related to HPV. November is National Diabetes Month. It's estimated nearly 40 million Americans live with diabetes, including adults and kids, according to the National Institutes of Health. More and more younger people, though, are now being diagnosed with type 2 diabetes. Naomi Ruckham has more.
Measurement of
Janiyah Lewis was diagnosed with type 2 diabetes 5 years ago. Just 23 years old, she says it was a shock.
Because I was eating right, I was exercising. For the first year, I ignored it, but I couldn't anymore because my body kept getting tired.
She says managing her diabetes with a toddler has been challenging.
It's really hard for me to stay focused and take care of myself the way I need to.
More children, teens, and young adults are developing type 2 diabetes in recent years, according to the CDC. Dr. Colette Knight says that's due to factors such as being overweight and less physically active.
Diabetes is associated with many complications: heart disease, kidney disease, and stroke. And so it's important to identify and to treat early so that these young adults don't develop the complications.
35 is the recommended age for adults to be screened for diabetes. Earlier if you have family history and conditions such as high blood pressure or cholesterol. The Molly Diabetes Center at Hackensack University Medical Center offers classes focusing on nutrition, exercise, and managing medications.
working with them in terms of, yes, having regular meals, having snacks maybe that don't contain carbohydrates.
Lewis has learned it's not just about what she's eating, but when.
My blood sugars were so high because I tend to not eat all day, and then at night I would eat big meal, and it would just spike it.
And she's trying to find time to get moving. She's also learned walking can help keep her blood sugar down.
The American Diabetes Association says nearly 9 million adults with diabetes in the U.S. are undiagnosed.